In this presentation, I'm going to address the problem of bullying in nursing, especially in aged care. Also, I'm going to identify how effective leadership can resolve this problem and what our responsibilities as new grad nurses are when we come across bullying in the workplace. The aim of this presentation is to help newly graduated nurses to recognize bullying at workplace and educate them on how to manage it. Before we begin, let's take a look at the video.
Would you mind double checking my level? Well, I'm busy right now. Oh, are you sure? Yeah, sorry. Okay, I guess that'll be good enough. Set of eyes. I guess so. Hello, Mr. Smith. I have your insulin for you. Let me know if you have any issues.
How do you feel if you need help and no one assists you? The video shows one form of bullying. Bullying is one of the most concerning forms of aggression in healthcare, and it often comes about as a result of pressure staff are under in today's workplace. Unfortunately, workplace bullying is an escalating problem in nursing. Bullying refers to unwanted actions that are made on purpose to humiliate and offend. Bullying leads to distress in the recipient and is a very serious problem that threatens patient and nurses' safety and the nursing profession overall. Healthcare workers in aged care, including registered nurses and AINs, can experience a high rate of workplace aggression, external emotional abuse, physical assault or threats, and bullying. Based on the research, nearly 60% of aged care health professionals within a period of 3 months and over 75% of AINs within a period of 2 weeks experience bullying. Aggression related to bullying is prevalent in the aged care setting. In the aged care setting, excessive demands on staff can lead to insufficient time of care for patients, which can cause external aggression and frustration. Health workers in aged care usually work under conditions of rigorous long-term demand. Aged care nurses are underrepresented and understaffed compared to other areas of nursing, despite increasing needs for aged care nursing staff and increasing aging population in Australia. There is evidence that high job demands with low work control and social supports are significantly associated with raised rate of bullying and aggression. This is a problem because workplace bullying can be a vigorous stressor that can affect the psychological and physical well-being negatively. For example, depression, anxiety, reduced productivity, decreased job satisfaction, poor life quality, and even suicide. Bullying prevents nurses from providing quality care. It impacts their performance and their collaboration ability. More importantly, it could compromise patient safety as they are influenced by nurses and other health professionals. This is supported by some research that look at the consequences of bullying for aged care nurses. A remarkable percentage of nurses leave their job because of the co-workers' negative behaviors, and it has especially worsened the increase in the nurse shortage. It also contributes to a toxic work environment and greater nurse turnover, which cost hospitals an average of $7 million per year. New South Wales Health has set a policy of prevention and management of workplace bullying. Also, the NSW Health Code of Conduct provides the standards of behaviors and conducts that are expected of all staff workers at all times. Workers, including health professionals, are expected to achieve a positive workplace culture by respecting others according to NSW Health core values. These values are collaboration, openness, respect, and empowerment. NSW Health also runs programs that provide advice about workplace bullying. Firstly, Anti-Bullying Advice Unit is a culturally sensitive, confidential telephone advice service for staff. This assists to facilitate links for callbacks to their own organizations for local resolution. Secondly, Anti-bullying management advisors are frontline advisors providing advice and guiding managers to manage bullying problems effectively at the time of they occur. Thirdly, anti-bullying contact officers have been established in some agencies across NSW Health. The staff who is nominated providing independent advice and assistance for lodging a bullying complaint. Lastly, NSW Health has adopted a zero tolerance policy to workplace bullying. This policy is to assist informing nursing managers of the psychological consequences of bullying at work and improving their sensitivity. Therefore, nursing managers can have better recognition, intervention, and prevent nursing bullying. Leaders play a critical role in influencing safety, associated attitudes, and actions in the workplace, as they are in a unique position to prevent and eliminate bullying at work. Therefore, effective leadership can minimize the risk of exposure to bullying behavior. When facing bullying issues, good nursing leaders are aware of bullying inside the organization while talking to staff. Also, good leaders take all reports of bullying seriously and respond to them quickly, deal with bullying behaviors immediately in a firm manner but without accusing. Furthermore, they empower nurses to hold each other accountable for supportive working culture and report bullying, as they are often more bystanders than bullies. Effective nursing leaders also try to eliminate any situational factors that can worsen bullying. Effective leadership can contribute to mitigate the bullying by assuring confidentiality and promptly dealing with the issue. It also provides ongoing support for the staff and provides them with feedback. As a new grad nurse, what we are expected to do in dealing with bullying is to maintain code of conduct and ethics standards for nursing to ensure a safe and supportive environment. Code of conducts are consistent with national laws. We all have a responsibility to build a positive, culturally safe work environment as a health professional. It is important for the witness of bullying to speak up and support the person who is being targeted, regardless of them being a new grad nurse or a senior nurse. In terms of legal point of view, it is illegal to conduct unreasonable behavior, including workplace bullying and discrimination under the NSW Anti-Discrimination Act 1977. A new graduate nurse must understand that unlawful behavior can be seen as professional misconduct and have consequences for their registration. According to Nursing and Midwifery Board of Australia, nurses should understand that bullying at workplace is not acceptable or tolerated. As a new graduate, it is important to recognize various forms of bullying, such as physical and verbal abuse, racism, violence. Other forms of bullying including aggression, humiliation, pressure in decision making, exclusion, and intimidation directed towards people or colleagues. This helps us to recognize being treated unfairly, and it helps to dealing with bullying faster. All staff, including a new grad nurse, must acknowledge how to recognize, respond, and report the incidents of bullying behavior. It is important to seek help as early as possible and before a situation escalates. Furthermore, it is recommended to attend all necessary training and participate in other relevant learning activities to contribute to achieve a safe workplace. In conclusion, it is our responsibility to be actively involved in changing the workplace culture and to understand that bullying should not be allowed in healthcare. We have identified how important the leader's role is to prevent bullying in the workplace. As a new grad nurse, we are also a leader of nursing and we should take accountability to create a positive working environment. Thank you.